What's going on, guys? Welcome to the newest episode of All Things LOCS, where we discuss everything related to leadership, operations, culture, and strategies for growth. Now, if you're running a healthcare practice, you might ask yourself this question: why aren't our reviews as good as they should be? Or why don't we have any? Or maybe you're wondering why your patient retention isn't really where you think it should be, especially if you get really good outcomes. And today we're going to be talking about everything related to the patient experience. And what this is really going to come down to is not just how do you create a great experience, what does it actually entail, but how this plays a role, a very significant one, in your own company's growth and how it has a massive impact on not just the outcomes that you get and the standing that you have in the community, but really on your financial bottom line as well. And that's why I just want to get us going right into it. Now, when we talk about the patient experience, really one of the biggest misconceptions is that if I get a great outcome, that means I had a great experience. I used to think that too. I used to say, well, if I get them better, this is when I was in orthopedics, I got them the outcome, which is maybe get them out of pain, or, if you're looking at functional ADL kind of goals, I got them back to going up and down steps with no pain. And then I find out a year or two later from that patient's friend or relatives that they went somewhere else for treatment. Or I remember treating a patient, and that was their story. She tells me, I went to another clinic, and they got me 100% better. And the first thing I remember thinking in that moment was, why are you standing here for your current ailment and not going back to the clinic that you were going to, especially if they got you 100% better? And that's what really started, helping me understand why, what actually is the clinical patient experience. And when you really factor in what patients are looking at and how they're really, now I know it sounds harsh to say this, but how they're judging you. Because again, we have to factor in no matter what step of a patient's journey they're in, they're always assessing the practice. That's just the way it is. Just because you had a great phone call doesn't mean 2 weeks from now they're going to have a great visit. Or if they had a great visit one time, doesn't mean that they can't have a bad visit the next time and never come back in. And I've had that happen, and I'll share that story later on. But in reality, once we understand, all right, what is the actual patient process, the journey, so to speak, then you can start understanding where do we maybe need to improve ourselves, right? Especially if you're looking at some of those variables that I mentioned in the opening of maybe your patient retention, or maybe you look and say, why aren't our reviews that good? Or maybe why don't we have any reviews? I've certainly looked up a number of practices, been around for years, and I just scratch my head when I see things such as 2 reviews, 5 reviews, right? The whole goal of healthcare, yes, get the patient the outcome if it's possible. And I'm obviously saying that, knowing that we can't always help the patient. But then why is it that some patients don't get an outcome? They don't get better. And yet they'll come back if they have an issue that you can treat, or they'll refer friends and family. And then the patients who you get an outcome on, they don't refer you anybody. And some of you might be saying, well, hey, you know what, Dan? Referrals are not that important to me. They should be, because it's a direct implication of what you're doing with the patients. So it is actually a little bit of a benchmark. That's one of the biggest things I looked at when I was running a practice was how many referrals are we getting from other patients? Because to me, it says everything about the experience that the patients are having. And that's what it should be telling you as well. And number 2 is that you got into this business to help patients. So wouldn't you want to treat more patients, especially the referral patients? And then number 3, no matter how you cut it up, you're spending money on marketing to bring in new patients. Doesn't matter what kind of field you're in, physical therapist, chiropractor, orthopedic, you're into aesthetics, whatever it may be. You're a cash practice versus an insurance-based practice. You still need patients. If you're not treating patients, you're not staying open. So you have to spend money on marketing. Or you can spend less money on marketing by getting more referrals. And that's only going to happen if you deliver a dynamite patient experience. Now, when we talk about this, I'm gonna do a real quick snapshot on this. Again, a lot of us think the patient experience is everything that happens once they're in the office, or maybe you're doing telemed and it's what happens during the visit. But then we forget about what comes before that. Can they find you when they're searching on Google, or nowadays even ChatGPTs of the world or Geminis? Are you easy to find, right? Because if you can't, if somebody can't find you, they're not coming in. And we know on Google, majority of people, I forget the exact number, but I believe it's 80%, a little bit more. They don't search below number 4 on Google's homepage. And if you think about that for yourself, how many of you have ever even gone to the second page of a Google search in your whole life? Right? It's minimal. So if they can't find you and you're making it difficult for them to even try to make an appointment, you're ready to start the experience off on a bad foot. And then when we talk about that first phone call, and a lot of offices I know are struggling now in terms of being able to handle call volume. So maybe they've either outsourced or you have a call center, whether it's based in the US or it's based overseas. Maybe some of you have taken the leap into AI agents. But the most important thing is, how long does the patient actually have to wait to speak to somebody? And if it's a very long time now, I don't know the exact definition or how you want to define waiting a long time, but if it's a first phone call, if it's more than a handful of minutes, that's way too long. And I've been on the phone with some offices for 15 minutes before anybody even picks up. Right now, you might say, well, I don't know, Dan, maybe you just sound impatient, but who really wants to wait 15 minutes on hold to have an initial conversation? Right? So you're ready. In that instance, I'm already getting irritated. And I know time for me, I don't like it being wasted. That's one of my pet peeves, but there are other people out there like me. And in reality, even if that's not a pet peeve of yours, everybody's got things to do. So what is it like for them to actually even get on the phone with somebody? And then what is that first phone call even like? I've talked about this on other episodes. If that first phone call where you're doing essentially a patient discovery call, if all you're asking them is their insurance information, you're essentially telling them we only care if we get paid on you or not. That's it. And I know you might not think that and you might disagree, but that's what's happening psychologically to a patient. If you don't even ask, you might say, all right, what brings you in? But then you take no history. And you just, all right, what's your insurance? Let me see if it's covered. And then maybe, okay, now what's bringing you in? You're telling them, hey, we are more focused on how much we can make. It should be the other way around. Get some information. Do a discovery call on these patients. Hey, what's bringing you in? What's going on? How long have you been dealing with this? What kind of symptoms have you been having? Because I can tell you right now, outside of actually having a massively positive impact on the patients, think about this from a standpoint of the doctors, clinicians that you're working with. They want to try to get as much information ideally as they can about the patient too. So if I'm, maybe running a chiropractor office and I see a patient intake and all it says is patient coming in for low back pain. Wow, I'm a chiropractor. I'm going to assume majority of my patients are coming in either for neck pain or back pain. What is that actually telling me? How long is it going on? Is it radiating down, pain radiating down their leg? Do they have any numbness, any weakness? Have they seen anybody else for this treatment? That's what I'm talking about. That's all part of the journey, because then when the patient comes in, that information is going to make their experience actually a lot better. And then when we talk about getting to the practice, is it easy to park? Right? I know you might say, all right, come on, are you serious? I've worked at a practice, a phenomenal practice, and we had an issue with that. The parking lot, because of the city ordinance, can only fit so many people. And we had, and I'm not proud of this, but it is what it is. We had not patients, we had employees. That's essentially, park across the street. You're like, all right, not a big deal. But it was a busy road. So, I'm being serious. I was always worried somebody's going to get hurt. So at some point, employees would say, I'm going to park in the main parking lot. And then there's times where patients would show up and call the office and say, hey, there's no parking. Right? You're like, all right, come on. That sounds like a joke. It was a big parking space, big parking lot, it was a very busy center, very busy practice. So, that's what I'm talking about. You're setting the patient up to be very stressed. And in that situation, I think maybe once or twice patients just left. I don't blame them. So is it easy for them to park? Is it easy for them to find your practice? There's a lot of you who don't have a standalone building. You're part of a medical building. Yeah, well, floor 3, second right, things like that. So is it easy for them to find you? And then once they walk through the door, what happens? Do they get a very positive greeting? Or is it, what some patients hate the most about a lot of offices is the front desk. I love my doctor, but the front desk, they're so miserable. It's not my feedback. I've literally heard that from patients, and I'm sure you probably have heard that too. So what's their experience like when they first come in? And then what's the experience when they're getting treated? As the provider, the clinician, however you want to classify them, are they listening? Are they being empathetic? Are they giving diagnosis? Are they laying out what a treatment plan is going to look like? Is there follow-up to your visits? And it's not just the first visit, which call it like it is. I don't even think a lot of you do that. Patient comes in for the first time. How many of you actually call the patient the next day to see, hey, how's everything going? Did you have any follow-up questions? Anything that was unanswered? I mean, this is doctors, and I'm not nitpicking doctors. It's a prime example here. He'll do a surgery or halfway decent, serious procedure, maybe an epidural, radio frequency ablation. Nothing, I get it. Nothing really that detrimental, but no follow-up call the next day to the patient. How do you know the patient didn't have an adverse reaction? Especially maybe they're going under and they have an anesthesia. Or if you're a physical therapist or occupational therapist, maybe you're dealing with somebody who's in a ton of pain. You don't want to maybe call them next day. Hey, did you have any flare-ups or was everything okay? Did you have any questions? Right? I don't have time to do that, Dan. I mean, give me a freaking break. How long does a phone call take? I know we all have notes to do. I get that. Home exercise programs. But I want you to think about this. You don't have a minute to follow up with a patient. But then you don't think, what could that minute mean to a patient? And I've had patients literally telling me, you were the only person who ever called me. I've never had anybody call me. And I can see how much that meant to them. So when we're talking about this customer journey and the customer experience, this is what I'm talking about. It's what are you going to do to essentially differentiate yourself from people too? Because I've also heard that argument, well, nobody else does this. That's why you do it. Why the hell would you want to do everything else that everybody else does? And then you're scratching your head saying, gee, why, how do I differentiate myself? Let me spend more money on marketing, or we need to create different ads. Guys, it's right in front of you. Part of creating a great experience for a patient, and I've had people argue me on this, but is understanding what does customer service look like? What does high-level customer service look like? And I want you to think about this. If you go to a La Quinta, which I'm sure some of you are probably saying, dude, I'd never step in there. But let's just say, for argument's sake, you go to a La Quinta and then maybe you start doing really well. You open up a practice and you're making some good money. And you take an anniversary trip and you say, you know what? I'm going to splurge. I'm going to stay at a Ritz-Carlton or Four Seasons. And their customer service blows you away, right? They come in, they greet you, they're happy, they're smiling, they take your bags up for you, don't even expect a tip. How does that make you feel? I'm talking about inside, right? Like, ooh, let's all, any of you who've had that kind of experience, maybe not a Ritz-Carlton or Four Seasons. I haven't experienced either of those two, but I've been to some pretty nice resorts. You feel good inside. There's a difference. Like, ooh, this is nice. I wouldn't mind experiencing this more often. And this is what we're talking about here. So when we get into understanding, why the retention, why this experience matters so much. Yes, you're obviously doing something very powerful for the patient. But when we think about what is the overall effect for you, and I mentioned it at the very beginning, which is if patients don't come back in, how the hell can you get them better? And I guess some of you are not treating in clinics that you're seeing patients multiple times a week or even multiple times a month. Maybe you're seeing them once. So you might be, this doesn't pertain to me because I'm not coming back in over and over again. I'm not a PT, or I'm not a chiro. I'm not an acupuncturist. It doesn't matter. At some point, potentially, the patient might need treatment for something that you can help them with. So if you're not focused on how this could improve your retention. Now, if you are one of those offices that sees patients multiple times a month or multiple times a week, how much money, number one, are you losing by not having a really great retention rate? And then how many outcomes are you not getting because the patients are not coming in to the frequency that you want them to? Right? So then we want to scratch our head. Hey, why aren't the patients getting better? Or some of you will do what I used to do back in the day. If you don't have a poor retention, the patients just aren't that committed. Right? They're coming in, they should all be motivated. I wish. I mean, I still remember the first time I was interviewing a new grad, and I asked her, why do you want to work in this kind of environment? And I couldn't help but laugh when she gave me the response, because it was just all the patients are motivated, right? I wish they were all motivated, but you can't help them if they're not coming in. And there are going to be some patients that are not committed, but there's a lot of patients who they would commit and they would have a really good retention if you knew how to actually improve the experience. And then we talk about completion of care, right? That's one of the biggest issues with some of you out there, is that, hey, they're great for about 70% of the treatment, and then the patient just kind of falls off. In physical therapy, that's a huge issue. Majority of patients never finish their care. So if you're providing them a great experience and understanding, all right, what does this actually mean? It's not just a matter of me getting you better. It's me communicating to you, me allowing you to ask questions, me answering the questions that you have and not making you feel stupid. And if you're in, discipline where progression is the name of the game, are you actually getting patients better? And if you are getting patients better, are you changing the plan of care? Because think about it like this. If you're going to the gym, how many of you, now some of you might answer, I do this, but how many of you realistically would keep doing the same exact exercise with the same exact weight and the same exact reps just forever? I would hope you wouldn't, right? But then there's some of you out there who give patients basic stuff at the beginning, and they're still doing it at the end, and then wondering why they fall off. Why didn't they come back in? So we have to understand this aspect. So part of this too, guys, is really knowing you have to put yourself in the patient's position, the patient's situation. If I was the patient, what would I want to experience? And some of you, I'm sure, have gone to a doctor. What was that experience like for you? The ones that really stood out, what did they do differently than the ones who stood out for the wrong reasons? Right? The ones who stood out and you say, I love this person. It was a great experience, great visit. All right. Why? And for the ones that you leave and say, I would never go back to that person, I would also ask you the question, why wouldn't you go back to them? What was so negative, or what was so bad or frustrating? And do you think you do any of that? Right? And then when we talk about marketing, and I mentioned a little bit, is that there's a cost associated with bringing in new patients. I don't know how much that is for you. And if you're not tracking that, by all means, you really should start paying attention to understand how much does it cost us to bring a patient in. And then how much, value. And I know some of you sitting there saying the value of a patient, like, this is just about getting people better, Dan. Yeah, it is. But again, at the end of the day, you are running a business. You do realize that, right? I know healthcare, that is the challenge. Obviously, we're all patient-centered. But if you're not making money, you're not staying open. And then you're not helping patients, and you're not hiring staff. So let's call it what it is. What's the long-term value of a patient? Again, do they come back in for treatments when necessary? So that lifetime value, this is where that's going to add up to. So maybe it costs, I don't know, $200 for you to bring a patient into your practice. And maybe, throughout their lifespan, every patient generates you $1,000. All right, now I know. How much am I spending versus how much am I making? So if you say, well, this is not important, do any of you actually do a budget? This is part of a budget. Because then if you say, I can't spend money on marketing, well, why not? If you make 5 times your return on every new patient, you know what? I didn't even know that. And that's what I'm talking about. But all these numbers won't get bigger, and they won't get better if we don't understand what aspect of the patient journey is potentially limited. And for some of you, maybe it's 0. But when we talk about, having a poor experience, right? And we think about cancellations, no-shows. Those, I don't know about you. No-shows for me pissed me off more than anything. I think all of us appreciate if somebody calls to say, hey, I'm not coming in, but for someone to just blow me off, and I'm not talking about those one-offs where, hey, I was sick, I had the flu. Like, by all means, don't call me if you have the flu, or your kid was sick. Shit happens. Patients forget. But there are patients who purposely, I'm not going to call them because they know I'll probably get on the phone and try to influence them to come in for the visit based on how important it is for them. So that shit would piss me off. But are they no-showing? So are they just blowing me off? And then we talked about that drop-off rate. How many patients would just stop treating? Maybe they got good enough, in their opinion, right? I know for some of you out there, you're like, I want them to be 100%. Dude, I get it. That's what I used to do. Some patients don't care. They don't want to be 100%. They just say, get me as good as I need to be, that I don't need to keep coming in and paying a copay and wasting time. I mean, that's how they look at it realistically. It's a waste of time to spend maybe half an hour to an hour and 15 or an hour and a half multiple times a week. So they're going to say, I'm good enough. I can do most things fairly comfortable. Peace out. But when we think about the psychology of that, and a lot of you out there are saying, I wish I can get patients to trust me more. Or I wish I can get, more compliant patients or more loyal patients. This is exactly what we're talking about, right? Would you rather spend money to get patients through the door and then have to spend more and more money? And I remember a long time ago, I was in basically a leadership meeting, and practice with doing phenomenal. But our retention rate really wasn't all that good. And I remember saying, we were talking in the meeting, and the CEO is trying to get a handle, just asking leadership, hey, what do you think's causing it? What do you think we could do better? And I remember one person basically spoke up. I'm not knocking the guy, but he spoke up and was like, what's the problem? Like, we're busy as hell. So what if some patients drop off? That just blew my mind. Because again, you're, number one, trying to get patients better, but number two, we're spending money, right? And this is the way I want you to guys, when you think about money, because I know this is a big challenge for some people in healthcare, money is almost like this evil thing. Money can be used for so much good, right? So if my numbers on retention aren't great and I have to spend more money on marketing to bring patients through the door, that's less money I get to spend on the employees. That's less money for bonuses. It's less money for new equipment. That's how you have to think about it. How can I take the money that I'm making and actually reinvest it back into the business to provide a better experience for the employees as well as for the patients? So when we're talking about all these things in this episode, this is what I want you to really think about. And if at the end of the day you just say, hey, look, I'm doing that already, and hey, maybe the extra money I can just utilize for myself, good. It's the whole point of making opening a business. You want to get outcomes for patients, but at the end of the day, you didn't open a clinic or a private practice to just work 60 plus hours a week and kill yourself and have no life and not even see your family. At least I don't think that's why most of you did it. So this is why we have to understand this. So when we look at, the stages of patient experience and their journey, and we touched on it at the beginning, I want to spend a little bit more time in each stage, right? How easy is it for them to find you? And then what does your website look like? Is it crap? Is it outdated? I know it sounds harsh, but some of you have websites from 2000, or you say, well, I'm going to skimp out and do this myself. Look, at the end of the day, if any of you are spending thousands of dollars on a website, you're overpaying. But that doesn't mean you have to do it yourself. Most of us in medicine are not creative. But then you're going to go to a website and say, I'm going to develop this. I'm going to design it. And then it looks like trash. I've done it myself, so I know. We have more resources and more tools available to us now than ever. AI is not meant for everything, but there are actually some amazing AI-generated websites. And the cost of building some of these things out is so much cheaper. So just use your resources, focus on what you're good at. But it makes no sense if somebody clicks on your website, and it's not even a matter if it looks kind of crappy or it looks old. This other aspect of what kind of message are you trying to convey to potential patients when they click on your website? Do they even know what you do? And I'm being serious. You might say, well, come on. Click on your own website or click on a competitor's website. How long does it take you to figure out what they actually do? Because you'd be surprised. I've clicked on numerous medical websites, and I'm just, what are they doing here? What kind of service are they providing? Who's their ideal patient? I don't know. I don't know if you guys have ever experienced this, but a patient comes in and you don't even really treat them for what they're coming in for because they didn't really know by the website. They just maybe thought, or based on what the website said, they thought you could help them. So do you have clear messaging? That's very, very important. And then again, how easy is it for them to get a hold of you? Is there a number that connects right to the office? Did you outsource it? And is this somebody overseas who, no, not for nothing, we've all had this experience. Is the person they're talking to easy to understand? Call it what it is. And if it's an AI agent, is it an AI agent that tells somebody, hey, I'm AI? And again, some of you might be saying, I would never use AI. Don't judge a book. Utilize some of these platforms because there are actually some amazing tools out there. But not every patient wants to speak to an AI agent. So is it kind of resource that says, hey, if you don't want to speak to an AI and you want to speak to a human, press 1, you might wait a few minutes. So at least they have a choice. Right? And then when they get a hold of you, number 1, how quickly are you answering the phone calls? Again, patients don't want to wait. You don't want to wait. And I always find it funny when we have certain views. I don't want to wait. They better do this, they better do that. But then we do the opposite. Right? Well, they'll wait, or they really need the help. Not a big deal. So you have to treat this as if it was your own. And now again, if you're the kind of person saying, I don't mind waiting 15 or 20 minutes, then don't run through this exercise. But patients don't want to wait. And a lot of patients, honestly, especially if you're running kind of practice that's open 9 to 5, they're going to be calling on their lunch. So number 1, they're chewing up the only free time they have between 9 to 5. And number 2, they might not even have that long. Some people have a 15-minute lunch or a half an hour lunch. So if you're going to take 15 minutes of their time, you know what I mean? You're already creating a very negative mood. And then again, I mentioned at the beginning, what kind of information are you taking? Is it patient-centered information? Is it all insurance? Or, hey, Dan, what are you calling for? What do you have going on? What kind of symptoms? How long have you been feeling them? Have you gotten any kind of treatment? Have you seen anybody else for this? Have you gotten any diagnostic tests? This is all information that's very useful and that's going to make their experience a lot better. So, meanwhile, you're saying, well, I'd rather get the patient off the phone as fast as possible because that's good customer service. If I only have them on the phone for 30 seconds, I didn't waste their time. You didn't even use their time wisely. Now, I'm not saying to be on a freaking intake call for 20 minutes, but could you take 5 to 7 minutes to get a plethora of information that's going to make their first visit that much better? I think you can. And if you can't, then you need to start figuring out, all right, do we need to do more training? Do we need to hire somebody else? Do we need to bring in, a call center or an AI agent? Something. Because if you only have 30 seconds, you're failing the patient right from the beginning. I'm telling you that right now. And then, we talked about those arrivals, that first impression. And I gave the example of a practice I used to work for. But when we talk about, all right, parking was easy, finding the location was easy, there's enough signage, right? Again, it's Suite 305. I don't know where Suite 305 is. Do you have any signs available? How easy, and this is what we're really talking about up until the point where the patient gets treated, is how easy do you make this for them? If every step is simple and streamlined, or is it difficult? Hey, I got here on time, but I parked on the other side of the complex, so I wasn't really sure, and then I didn't see a directory, so I didn't really know where to go. I think most of us have had an experience either like that or similar to it, and you're already getting, and then you're stressed, right? Now you're making the patient stressed. You're saying I was on time, but now I'm late. Is this now going to make me have to wait an hour and a half? Right? Because then we factor in, all right, what's a normal waiting time? Some of you are freaking amazing. You get patients right in. But then there's, we've all had that experience. You go to a doctor's office and you're sitting around for an hour. And some of you might say, well, hey, that's just the way we schedule, or I can't do anything about it. I'm not in charge of the scheduling. Then talk to the person who's in charge of the scheduling and help them understand, this is actually pissing a lot of patients off. And I forget what the numbers were, but I think it was a pretty high percentage. I think over 50 or 60% of patients, I'm going to have to find the numbers exactly for you guys, but it was 50 or 60% of patients would never come back to a practice if they had to wait, I think it was over 30 or 45 minutes. And it was a large amount of patients who wouldn't even refer somebody else based on waiting time. There was another one. I want to just actually look at this one to get it right. The American Journal of Managed Care. So they did a study of about 11,000 outpatient surveys across 44 ambulatory clinics. And they found that longer clinic waiting times negatively affected not just overall patient satisfaction, but confidence in the provider or clinician that they were seeing. It negatively affected the perceived quality of care, which means they automatically think by waiting longer, the quality of care is going to be worse. And it reduced the likelihood of them recommending the practice. So when you're thinking, not a big deal, make them wait, it is a freaking big deal. And again, I'm not telling you to be, hey, you signed in, let's bring you right back in and get you going. No. But you have to understand, you're wasting time, and this has a negative effect on you. And then outside of all those things, they're not going to refer anybody. They're probably not going to come back in. They think you're going to provide worse care. Are they likely to refer somebody else in? Right? Even if they have a great experience with whoever is treating them that day. Maybe, oh my God, best doctor I've ever encountered. But damn, I waited a long time. There's always that but. Or maybe they refer somebody and say, you got to go see this doctor, but you're going to wait a long ass time. Now they're actually, it's almost Inception, the movie. Now they're incepting a thought into that future patient's brain. And whenever somebody says, oh my God, I got to wait an hour, it sours the visit a little bit. It's like going to a restaurant. All right, maybe the food is amazing, but the service sucks. I know, imagine that. But do you walk out of that restaurant saying, that was phenomenal, that was a 10 out of 10? No, you're going to say exactly what I just said, which is food is phenomenal, service was horrible. And how many reviews do you see like that? It's very rare that you see service is great, food is terrible. It's usually the other way around. Now, is that person likely to go back to that restaurant? Some people will, but a lot of people won't. And the same applies to your practice. Right? And when we think about the mood and the psychology of the patients when they present themselves to your practice, are they all coming in saying, hey, all right, I'm happy to be here? No, because if they were doing that, they probably wouldn't be showing up, because it means they don't have anything wrong with them. Right? How many patients show up, anxious, nervous? If you're dealing with pain, are they in the best mood? Right? I mean, I've had so many patients either yell at me, and again, you might say, well, maybe it's just you. Yeah, maybe it is just me. But no, they've gotten, angry with me, and then after the visit, I'm so sorry. And it's the state they're in. How many of you been in pain and been chipper as all hell? You're like, yeah, I'm not. I'm kind of an angry jerk off. Right? So it's take their emotions into consideration. And maybe, I know I'm talking a little bit about pain here, but maybe you're seeing somebody for cancer. Are they in a great mood coming in? And then the experience is so-so. This is what I'm talking about. All right, so then when we think about that, how do you guys mitigate that? What does your front desk do to change atmosphere for the patient? And then once they enter the room to treat with the clinician, right, what is that like? I know some of you might say, hey, look, I'm not here to be empathetic. I'm not here to let patients ask 20 questions. I'm here to get them a result. Okay. For a handful of you, that actually works. For the majority of people, it doesn't know, right? And if you think about what a really great experience should look like, did you prepare? Did you actually look at their chart, right? Well, some of you love it. So what brings you in today? Look at their freaking chart. That's what it's telling them. It tells them you didn't even have the time or take the time to review what the hell you were seeing me for. Now, I know some of you say, oh, I'm just building rapport. That's not how you build rapport. That tells patients you weren't even prepared. Did you review their chart? Did you get, if they went somewhere else, do you have their notes? Right? So going in prepared, being able to be empathetic, listen, and let the patients ask questions. Right? And realistically, did you ask enough questions? And I'm not saying you gotta ask 20 questions. I know some of you could probably ask 1 or 2 questions and all right, I already know what's going on with you. But put in some effort, and then if you're listening and saying, well, Great, I have 6 minutes. Maybe you're a primary care physician, say, I have 6 minutes per visit. What can I do? This is where preparation is going to come in handy. And honestly, you got to figure out, all right, what one or two questions are really the most important? Or how do I build rapport with the patient without having to ask 1,000 questions? Right? And this is where you could just, all right, tell me a little bit what's going on. What's the history? What have you done? Okay. You know, some easy things you could do. Listen while the patient talks and don't interrupt them. That's a pretty good way to build rapport. It's also a good way to break it if you want to be the person who's interrupting them or cut them short. Okay, I don't have much time here. Let's get to the point. Those are the kind of things that sours the patient's experience. Being able to give them a diagnosis. Hey, this is what we're going to do to help you get better. All those things matter because a lot of patients, they leave visits saying, I don't know either what's wrong with me, or I don't know what's causing it, or I'm not sure exactly what we're going to do to get me better. So those things greatly matter. And when we talk about empathy, I'm telling you right now, it's the one skill patients look for the most in doctors and clinicians, and it's also the number one skill that a lot of doctors and clinicians freely admit they're not great at. So how can you get better at essentially, kind of putting yourself in the patient's scenarios? How can you relate to them? How are you communicating to them? And I would also add, how well do you show up in the sense of being confident? Right? And I know it's very prevalent in younger clinicians, but okay, so, I think what we're going to do, or I think what you have going on, why would anybody follow you? Why would anybody even believe you know what you're doing? And I know it's not just young clinicians. They're the worst. I get it. But there's some of you out there just soft-spoken. That's what patients perceive. You don't sound so sure. So if they think you're not sure, why the hell would they be sure of you? So why would they come back? Right? And then you get through all that. And then we talked about after the visit. Are there follow-up calls? Are there, some sort of communication to the patient? I know most of you won't call a patient. There's one doctor that I know, spine surgeon, who calls patients. He'll do it. He doesn't have an assistant. Calls patients. And he wants to know, how are you feeling? How are you doing? Any questions? And there's a reason that he gets patients from all over the country. And talking to him, he said the same thing. This is what differentiates me. This is how I separate myself. Yes, he's phenomenal at what he does. It's not some surgeon gets so outcomes. He number one created a procedure that nobody else done. Like, he literally created it. And then he gets great outcomes. And yet he still calls the patients. He doesn't have to. He decided that's what's going to separate me from everybody else. And then what is it like for them to schedule follow-up visits? Do they get reminders? Right nowadays, we have so many CRMs. Number one, if you don't have anything going out, you need to start there. Number two, if you say, well, I have somebody at the front desk who calls patients. Okay. I mean, that's great service, but is that, really amazing use of their time? Or can you say, hey, I have a CRM, it has automated reminders, goes out the day before, maybe it sends out a morning reminder too. Something that's going to make the communication a lot easier. And then, when we talked about the progression, so it's not just the follow-up visits, if maybe the patient comes back in, maybe if you're an orthopedic doctor or just primary care, you're not tracking their progress, so to speak, but you can also follow up, hey, you're getting better. Maybe you gave the patient 10-day medication. Why can't you call them on day 7? Hey, Dan, how are you feeling? Are you about 80% or I'm 100%? Right? And how many patients, they're taking a 10-day medication, maybe it's a Z-Pack, something like that. How many of them stop before they used all their pills? Even though you tell them when you give it to them, go through the whole thing. So why wouldn't you do a call with them maybe when they're 70% of the way through? Hey, you're getting better. No, I still feel like crap. Huh. All right, then maybe you should come in instead of waiting another 3 days. Or, yeah, I'm feeling great, but I stopped taking and I didn't do those last 3 doses. Okay. So why wouldn't you do that? Well, again, Dan, I have no time. Okay, then fine. In that instance, hire somebody else to do that. Or, again, you could pay somebody pretty darn cheap to follow up for you. And this whole This whole episode has been about how do you leave the patient feeling? What would that do for the patient? Holy shit, my doctor's office called me. Or holy shit, my doctor called me. Damn, that person cares. That's what it's telling patients. You actually care about them, because if we think about all the, distrust that patients have with doctors and just medical profession, it's not good, right? A lot of them listen to TikTok and Instagram more than medical professionals with doctorates and medical degrees. So you do things like this, all of a sudden your status is elevated, and they say, I trust this person. And I'm not just telling you, BS or hyperbole. I've literally had patients tell me that. You're the only person, right? You're the only person who ever called me. That patient always came back. And if they didn't come back, hey, Dr. Dan, so-and-so's on the line. I have a question for you. Yeah, my daughter hurt herself. Should I come? This is what, you know what I mean? It builds that trust factor with them. And again, these are things I've done that have delivered time and time again. Now, what are some common mistakes? Well, we talked about you think the outcome is everything, or I'm a great clinician, I got them better, and then you have no personality. And everybody's they're just saying, oh my God, it's so boring, I just want to get through this, right? So how do you make the experience as positive as you can for them? Then, if you work in maybe a multidisciplinary practice, or maybe you don't, but you have different departments, and then all working very independently, not communicating to each other. So every time they talk to the patient is essentially explaining the same thing over and over again. So maybe you work in, I'll give you a good example. Maybe there's a physical therapy office that has an orthopedic doctor. So the patient comes in, tells the physical therapist, here's what's going on with me. And then the physical therapist says, you know what? You'd really actually benefit from an orthopedic consult. I think you have some significant tears in your shoulders. I want to get a consultation. And then you don't communicate to the doctor what is actually going on with the patient. So the patient goes to see the orthopedic doctor, and then they have to explain everything all over again. Now you might say, not a big deal. But how many of you deal with patient scenarios where it's potentially devastating for them with what they're dealing? And maybe it's not a shoulder tear, which honest to God could be very devastating for somebody. Or maybe it's a runner, and that's their thing. And now my knee is shot. I'm not sure I'll ever be able to run again, and I have to relive that whole experience over. It's very emotional for patients. So you have to factor that in as well. And then we think patient satisfaction, right? Is everything. Satisfy your care? Yes. How many of you actually ask, would you refer somebody else in? Or would you come back in for treatment? And I gave you that example at the beginning of that patient who I treated, and she had gone somewhere else and gotten 100% better. Clearly, she was satisfied, but she didn't go there. And then, again, we talked about communication. Do patients have to repeat themselves over and over and over again? Those handoffs? How do we make this as seamless as possible? And then, how about the fact that I'm not saying your providers and doctors need to be the same, act the same, say the same things, talk the same way. But do you have somewhat of a standard experience? And I know some of you like having the same doctor or clinician work with patients to create that, hey, everything's the same. But not all of you do that. Or, what happens if doctor calls out and they have to see a different doctor? Is it going to be a drastically different visit? Or physical therapist goes on vacation. Is it a drastically different visit or visits potentially? Right? So having some degree of standardization. And when we talk about how to improve the experience for the patients and really knowing, what essentially is going to be your playbook. Best thing I would advocate for you guys to do is actually go through this yourself. When I work with other companies or I'm helping out maybe even a friend of mine or a colleague who's a business owner and they're trying to figure out how do I make this better, first thing I always do is I go through the customer experience, the journey, right? So if they have, like a good example, I have a buddy of mine who owns a life insurance agency, and he was starting off, creating a new branch within the business. And so he was telling me, this is what we're doing, this and that. Okay, great. First thing I did, let me go to their website. And then, okay, it says book a call. Let me book a call. Did the link work? It didn't. Could I book a call? Eventually I was able to. What did that phone call first look? It's And he was like, what do you do? I'm like, I'm trying to map what is it going to be like for your customers. Because if this isn't completely on point, they're not going to come back. Will you do that yourself? If you're a director or if you're an owner, when's the last time you actually went through, all right, what does our journey look like for the patients? And is it to the degree that you would want? You'd be surprised. You find something, maybe you say, well, yeah, it definitely is because I train the employees myself. Unfortunately, I have news for you. If you don't know this already, employees regress when there's no consistent training. It's just human nature. We look for the easiest way, and that doesn't mean people are lazy. That's just in our brain. How can I make this easier? We'll do it. Shit, I bet you do it too, right? How can I make this easier? So maybe they skip a step. And then you start evaluating, and all of a sudden, you're like, that's not what I taught you. Who taught you that? Nobody. I didn't think that step was necessary. Okay. So go through it yourself. And what this is going to do is essentially help you identify your bottlenecks or just those sticking points. Maybe getting on the phone for the patient, super easy. Or website, great. Found us in 2 seconds. Awesome. Made it really, super easy for them to find our number, get a hold of us, fill out a form. They waited for 30 seconds before the front desk picked up. They found us easy, got into the practice, walked in, front desk person was having a bad day. Yeah, what can I do for you? Ooh. Right? Or, oh, that's amazing. And then they get in for their initial eval. It's rushed. They don't get any time to have any questions answered. So you have to identify what aspect here along the journey is actually creating some issues. And then if it's a scenario where maybe communication is going back and forth between different segments of your practice, do those individuals who are in those maybe different departments, or maybe it's just from maybe it's the front desk to an athletic trainer or to a physician extender, right? Maybe it's I'm communicating to the PA or communicating to our nurse practitioner who's working with the doctor. Am I going to communicate to the nurse practitioner everything that needs to be communicated? Is the nurse practitioner then communicating everything to the doctor? Right? And more importantly, are you assigning ownership to those individuals? Because then there's also this aspect of, well, I told them. You did. Or I sent the email. Did they respond to you? Right? So it's, well, that person should have checked. 100% that person should have checked. But why can't you also just follow up, say, hey, Dr. Smith, just want to make sure you got this. Ooh, you know what, Dan? I actually didn't see that. Or, yeah, I read it and I forgot to reply to you. So otherwise, how would you know they even saw it? Creating standards within your office, right? The culture is set, and this is what standards are. The culture is set by the person at the top. How do you answer the phone? How do you greet patients? How do you onboard a new patient? What does your evaluation process look like? Do you communicate to patients what the expectations of visits should be? Right? And some of you just starting out in a practice, you're everything. You're the front desk, you're the janitor, you're the call center. So people are going to learn from you. And if you've been doing this for a long time, and again, and I said this at the very, very beginning, this pertains whether you're a cash-based practice or insurance-based. But if you've been doing this for a long time, go back in and evaluate, hey, you know what? I taught everybody this, but when's the last time I retaught them? Or when's the last time I retrained them? When's the last time I even evaluated how I'm doing with patients, right? Because it's cool it is. Some of you get older, and your patience starts changing a little bit, meaning your personal patience. You start changing your own habits a little bit. So, hey, when's the last time I evaluated how I answer the phone or how I talk to a patient? Because other employees are also watching. And the old saying, right? Monkey see, monkey do. So evaluate yourself as well. And then you need to measure, meaning what kind of data or KPIs can you actually look at to let you know, all right, is our customer experience or patient experience where it should be? And we talked about, referral numbers. That's a huge one. Online reviews we mentioned. Do they, patients complete care? Do they, would they recommend somebody? It's not just referral numbers. Would they actually recommend somebody? Because then you have patients who say, I would recommend somebody, but they don't always refer other patients. Maybe they don't know anybody. So we're talking about net promoter score. How likely would they want to send in friends and family? How many patients, no show? What's your no show rate, your cancellation rate, even your rescheduling rate? Even a reschedule is only good if the patient actually makes up the visit. How long does it take you to answer the phones? Right? These are things that you guys can measure and really need to. And as we, when we think about all this, again, it's not a matter of doing more work. I understand the challenges that we're all facing in healthcare. I have notes to do, patients to treat. I have a family to see. I get all that. I want you to understand everything we talked about doesn't really take any extra time. That's what really always dumbfounded me, is that we think these things take a really long time, when in fact, it could be a minute or two. But it's what your standards are, how you train yourself, how you train your staff. And when you understand how is what we're doing day to day actually affecting the outcomes for the patients? How's what we're doing every single day affecting the business? Right? And this isn't a matter of beating yourself up either. If you evaluate it and you're saying, shit, we're terrible. Or, no, it's not what this is about. But what I would recommend for you guys to really do is, again, go through your whole patient experience. And if you want to say, all right, I'll be the patient, I'm the owner, whatever, just run through it. And if you're like, I don't want anybody to know it's me, fine, then just get a friend, right? I mean, I think all of us have at least one friend or family member who everybody in the office doesn't know. Have them call. Have them come in for the insurance, for a visit. They're using their insurance. I'll reimburse you. Don't worry about it. Or whatever you got to do. You have to get some feedback. Oh, my gosh. What's that show? Undercover Boss. Now, I don't watch it, but we understand the premise, right? CEO goes in, pretends to be a regular employee, talks to employees, see what their struggles are like. It's no different. And then how many times, pretty much every episode, the CEO or owner saying the same thing. Holy shit. I thought we were doing this. I thought we were an A+. We're operating at a B level. So that's where getting this kind of feedback is going to make a big difference. Now, wrapping this up, guys, what I would also recommend outside of going through this yourself and identifying those bottlenecks, we are going to have essentially a patient experience checklist within the show descriptions. So if you just want to at least know, all right, what should I be assessing? That'll be available to you. Download that. Super easy. Take you about 10 minutes to go through it. But it's going to be really helpful and highlighting a lot of key areas where you can vastly improve the experience to the patients, which again is only going to help you get better outcomes and grow that business that you wanted to start. Guys, I really appreciate you taking the time here. Hope this gave you some massive value. I'm going to see you next time. Take care.